Prioritizing questions. The NCLEX examination is designed to determine if the candidate has the knowledge, skills, and ability to be a safe entry-level practitioner. There are approximately 9,000 questions in the NCLEX test bank, and each candidate's exam is unique. It is assembled interactively as the individual is tested. Each candidate must answer a minimum of 75 questions and a maximum of 265 questions to pass the exam. All candidates answer 15 so-called pre-test or unscored items, which are used to obtain statistics for use as future items. The maximum test time is 5 hours. The NCLEX exam is designed to be a difficult exam. The majority of the questions are written at the higher levels of cognitive ability, meaning that they require the candidate to do more than just memorize facts. These types of questions are known to educators as application questions, which test your ability to apply your knowledge to a client situation, and analysis questions, which test your ability to analyze a number of facts within a client situation. In addition, the NCLEX is divided into categories. These are not the typical categories you may have been familiar with at school, like Med-Surg or Psych or OB. Instead, the NCLEX looks at client needs, areas which are defined as safe care, health promotion, psychological integrity, or physiological integrity. The majority of the questions are in the physiological needs category, followed by safe care, health promotion, and finally, psychological care. Some common new areas of test questions in the past couple of years have included delegation questions, included in the management subcategory of the safe care environment client needs area. The client at risk questions, included in the reduction of risk potential subcategory of the physiological integrity client needs area. Disaster questions, included in the safety and infection control subcategory of the safe care environment client needs area. Multifactorial questions, which may be included in any of the categories. All of these questions typically require the candidate to prioritize and are written at the higher cognitive levels of application and analysis. Candidates often remark that these are some of the most difficult questions on the exam. We will be discussing techniques to use when answering these classifications of questions. The first strategy is that it is important to remember that the nurse in a test question is in an ideal situation that permits the nurse to choose the option that is best for the client. Unless the question actually states otherwise, the student should assume that the nurse in the question has all the time and resources necessary to do what is best for the client in the question.